Do 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 do. I don't know. Yes, no, maybe better. Okay. Can you see me? Or do I need to get on the stage? Here, how about this? Yo, yo, yo. Good morning, I'm Ned Kalange, President and CEO of the Colorado Trust. Thank you for joining us today as we kick off this year's Health Equity Learning Series. Before I introduce our... Yes? Before I introduce our speakers, however, I want to mention a couple of things. We created
It's good
She
here.
needs a haircut.
She looks great.
She needs a haircut real bad.
The whole world just saw you.
choice. Perfect. That's also the rumor about Roxanne.
I've
One
heard
can
that's
only hope.
definite. Oh my God. Yeah. Good morning. Hope folks can find their seats. I hate to cut off conversation, but I'd like to get us started. I'm Ned Kalange. I'm President and CEO of the Colorado Trust, and I'm really pleased that you're here this morning to help us kick off the 2014 Health Equity Learning Series. Before I introduce our speaker, I want to talk about a few things. First of all is to tell you the purpose of the Health Equity Series. We created this to raise awareness and understanding about health equity issues across Colorado. The Trust believes that all Coloradans should have fair and equal opportunities to lead healthy, productive lives, regardless of race, ethnicity, income, or where we live. And we think that this learning series helps us raise awareness and develop partners in that activity. Partnering with communities, we know we can advance opportunities for all Coloradans to be healthy. So I want to point out a few of the things that are at your tables today. We provided you with a copy of a new Trust publication dedicated to last year's Health Equity Learning Series. It was written by Sherry Walker and summarizes the presentations and stories from those Coloradans impacted by health equity issues. Also, there's a survey. You know, there is no such thing as a free lunch, so we hope you will fill out the survey, share your thoughts about today's event so that we can make things better as we move forward. I hope you will work on those. And I'm actually missing, double-sided. There's a short summary of Policy Link's All-In Nation report. There are the discussion questions that we hope you'll either think about today or take back to your areas to talk about health equity in your own settings. We can also find all of these resources as well as all of the events from last year that you can watch videos of our previous speakers at our website at coloradotrust.org. I also want to take a chance and welcome our virtual participants. We are live streaming this event with assistance from the Open Media Foundation. Hundreds of people are joining us online, and these 16 Colorado communities are hosting their own viewing party. So we're trying to make this not just be a Metro-centric event, but something we share statewide. So I want to add my welcome to all of those who are joining us from across the state. I want to recognize a few people that I hope will be here if they're not here yet. I haven't seen everyone on my list, but our Trust board members include Jennifer Paquette and Reverend R.J. Ross. And we have signed up to have some state legislators join us, Brittany Peterson and Senator Jeannie Nicholson. And if I missed anyone, I'll make sure I notice you later, and thanks for being here. Following the presentation, we'll engage in a dialogue with the audience. For those who are streaming the presentation, please submit your questions via Twitter. Follow the Colorado Trust and use the hashtag HealthEquityTCT. If you prefer, you can email questions to healthequity@coloradotrust.org. It's our intent to do our best to answer all questions we can today, whether you're in the room or streaming. So without further ado, I want to introduce today's speaker, Mildred Thompson, who's the director of the Policy Link Center for Health and Place. With a background in nursing, Ms. Thompson works in partnership with a broad range of groups to advance new policies and approaches to improve health in low-income communities and communities of color. I really appreciate the fact that I've gotten to know Mildred from the IOM Roundtable on the promotion of health equity and the elimination of health disparities. She's a good partner, a very astute thinker, and she has that one quality that we all aspire to in the room, that of wisdom. So with that, Mildred, if you could come up, that'd be great.
Thank you so much for those kind words. Good afternoon. It is my pleasure to join you here today, and I just really want to begin by expressing gratitude for the opportunity to join you as you have this important conversation about health equity. And really, I applaud the Colorado Trust for being willing to tackle this issue because it's really important, and not very many people want to take it as head-on as you all are doing. So I appreciate the opportunity. What I'm going to be focusing on today is sharing with you some of the work that we've been doing at PolicyLink in addressing issues of equity. Basically, our overall organization is focused on this issue of equity. I am the director for the Health Equity Center, so that I am going to be talking mostly about our health work. But if you want to know more about the other work that we do at PolicyLink, you can go to our website, which will be listed at the end. I'm going to be focusing on America's Tomorrow, basically sharing with you research that we have underway and showing how America is changing in terms of its demographic patterns. And then what does that mean? What does it mean about the work that we're doing? What does it mean in terms of our being willing and prepared to address these issues as they're emerging, and why we must care about this, and what we can do in terms of addressing solutions. So with that, I'm going to be talking about how we define health as broader than just absence of disease and illness. That health is an overall state of well-being, that it has to do with one's ability to have physical health, of course, but economic health, social health, and spiritual well-being. Again, PolicyLink, this is just a little bit about who we are. We have 4 offices. Our headquarters is in Oakland, California. We have offices in New York, which is primarily communications. We have an office in Los Angeles and in Washington, D.C. So with that, let's get into understanding how the face of America is changing. What I'm going to be showing you are maps. And I want you to pay attention to the orange and the red, basically showing how the country is changing from this is going to be projecting from 1980 to what we project for 2040. So as you see, 1980, we had the country, and you pay attention to the geographic areas where these changes are occurring, where you have people of color that are beginning to merge and to migrate into these areas. 2000, we're beginning to see more across the country. 2010, it was increasing further. This is what we project for 2020. Let me just pause and say, this is research that we're engaged with a researcher economist at the University of Southern California, Manuel Pastor, and we've been doing this work with this with him for a number of years, and we also have been working with the groups that's been doing the projections. If you want to know more about that, I can talk with you more in the Q&A session. But just seeing in terms of what we're projecting by 2013, how the country is going to be shifting by 2040, you're beginning to see how we are beginning to change our culture and our complexion. I should pause and also let you know that there are 4 states currently where there is already a majority people of color, and that is California, Texas, New Mexico, and Hawaii, where we already have the majority of the people who live there are people of color. So what does this mean for us in terms of how we're looking at the country? As we look at who are the populations that are growing, we're going to talk about the ethnic populations, but first looking in terms of ages. Ages 65 and older, you see less of people of color. It's mostly non-Hispanic whites. And as we look at children who are 0 to 4, that's where the population growth is occurring more rapidly. So we're seeing children, so women of childbearing age, or people who are beginning to migrate and have more children. So the children are the ones who are going to be much more people of color in the immediate future. So what does it mean in terms of our country? Well, basically one of the first things that we can say is that it's not the children who are voting, right? It's the people who are 65 and older who tend to be advocates and tend to be voting. So they're the ones who primarily help to shape America's policies and the agenda. And so we want to make sure that that population views children of color as still being their children, to the same degree that they were the ones who really helped to support Head Start as a viable a program that really makes a difference. Will they begin to see immigrant children and children of color who live here as still embracing them as being our children that we should all care about? Or will there be this more divisiveness? Now I want to talk a little about your state. You know, we just had our researcher just do a little preliminary look at some of the data to see how your state is shifting and to help you understand what does it mean for Colorado. So what you can see here is how the shift has occurred in Colorado that is quickly becoming more racially and ethnically diverse as well. And so as you can see in 1980, you had a largely, a much larger population of whites, and you see that population is beginning to decrease, and as we project, it's going to decrease even further. So we want to take a look at, well, how are we looking at who's coming in, and what does it mean for us? And so let's look into the actual areas. Now, I don't really know Colorado that well, but it's really clear to see how compared to the United States and where it's changing, looking at your state. So in 1980, this is people of color. And again, as we're looking at 1990, how it's shifting, 2000, something is happening up there in that area that wasn't happening before. I don't know that area, but those who are from there should pay attention to it. And looking at 2010, it's broadening a bit more, projections for 2020, projections for 2030, and projections for 2040. So how do we look at that, embrace it? How do we make sure that the work that we're doing is going to be meeting the needs of the populations in these places where that shift is occurring? And then my other question is, what's happening in those areas where it's not changing? I don't know. Maybe those are things that you all could discuss further among yourselves about what does this mean for our state. And then we wanted to take a look at some of the other indicators in Colorado to see how they compare to the United States as a whole. So basically what we're saying here is that the highest growth rates are occurring in Colorado as a whole among Asians and Latino populations. So there's growth occurring in other ones, but you can see where that's where the majority of the growth is occurring. Taking a look at high school graduation rates, there are a few things that we look at to determine and to assess the health of a place. And graduation rates is surely one of those. So if you want to know why we're choosing certain of these, it's because it's an indication of overall health. So again, when you take a look at the high school graduation rates, you see the largest population, Asians tend to be right below Asians or whites, and you have Latinos, Native Americans who are faring a little bit worse. What is also interesting in this next one is looking at median household income in Colorado to see how it compares. Clearly, Colorado's you all have a higher income than the general population of America as a whole, with Denver being higher than the state as a whole. So let's take a look at unemployment rates, another indicator. So then how is Colorado as a whole doing in terms of unemployment rates? With America's rate as a whole, 6.7, you have a much lower rate in your state. So this is looking like you have some good outcomes around graduations, around unemployment. Let's take a look at how we look at that unemployment rate by race and ethnicity. So when you take a look at this, however, and you go a little bit deeper, you're seeing how Native Americans and Alaska Natives tend to have higher unemployment rates. Second highest is African Americans, and then you have Latinos. So we still need to make some changes in addressing some of those disparities. And then this is one that's dear to my heart because I've been working for years around childhood obesity. And so looking to see how you all are doing as a state related to America's obesity rate as a whole. So again, you see where we're talking about people of color who are tending to have these higher than average rates. Now, we did have some encouraging news. I got a report last night from the CDC, had a study published in Journal of American Medical Association that's shown that childhood obesity rates are dropping finally in a significant way, that we've been waiting for this to happen for quite a long time. So in 2003 to 2004, the country's childhood obesity rates was 14%. 2011, 2012, it's dropped to 8%. So we're really pleased, and we want to make sure that whatever we're doing to make that change happen, we can continue to do that. But we also have to make sure that we don't get just to be so happy that these rates are being declining, unless we also make sure that it's addressing those populations who are already suffering the highest disproportionate rate. So that's enough in terms of your state. What we want to share with you a study that we were engaged in with the All In Nation. That is a partnership with the Center for American Progress. And when we did this demographic study, we wanted to see, well, how would Americans respond to this idea about the shifting demographics? So we were part of a survey in which we interviewed a number of households across America to see how much they welcomed. And what was really nice to see is that the majority of Americans responded positively to the shifting demographics. It's only a small pocket in the South where they were more concerned, where there were people who were more concerned than those who were hopeful. And even when we asked those who were really concerned, well, what were your major concerns? They had legitimate concerns. One, what does it mean in terms of jobs? Are these people going to come in and take my jobs? That's a fear that people have had for a long time. The other fear was very striking. They were asking, well, what does this mean for our America? Is our America shifting? Do I still define America in the same way that I used to in the past? So that's a question that we all have to answer. How do we look at this and see, do we view it as a positive, do we view diversity as a positive thing, or do we view diversity as something that we have to be afraid of or fearful? To what degree do we embrace it? To what degree do we make sure that our programs are meeting the needs in terms of the culture, the language, the way in which we do our work, the way in which we teach? We are really addressing what needs to be done in order to make sure that those who are coming here really are coming with a sense of welcoming in the way that our country was initially built and created. The other thing that we also were asking in this survey was, to what degree did people really welcome an equity-focused agenda? So once we see that the change is occurring, will there be support? And we were pleased to see 71% of people that we interviewed said that they support the idea of us having an equity-focused agenda. Now, it became a little bit interesting when we talked about, well, are you going to be willing to pay more taxes? Well, that wasn't quite as welcoming as, what do we need to do about it? But the fact that something should be done about it was really important that people would see. And this was significant because we don't usually hear this in the media. This is sort of contrary to what we hear in the media. I think the media in general don't tend to portray these changes as being welcoming. I think that we have to be careful about how we tell our stories and the messages that we have about our work. Okay, so why equity? Why now? Why do we need to focus on this, and what do we need to do about it? The reason why we need to focus on it is because what this means is that as a group, as a whole, America is really falling behind in a number of areas. And so if we look at the fact that, remember, we've got that large population of children that's beginning to be our growing population, how are they doing in terms of education? We're really not competing in the way that we should as a society. And then when we take a look at, well, what is going to be required as we move forward with the new growth in new areas around how the country's job market is faring. What was interesting to see is that currently 47% of all jobs require at least an associate degree. Yet sadly, only 27% of African Americans and 26% of US-born Latinos and 14% of immigrant Latinos reach that level of competency in terms of the educational requirements. So what does this mean in terms of their being prepared for the jobs of the future? And then what are the jobs of the future? The jobs of the future tend to be these jobs around the STEM sciences, healthcare support, and community services. As we did further research around what are the marketable skills that's needed currently to compete, not only in this country, but globally, because we're part of a global society, it's less about the jobs that involve physical labor. And it's more about the jobs that involve critical thinking, analytical skills, leadership, communication, and active listening. Gee, that's very interesting. How are we preparing our children to be able to be competitive in this new environment that we're going to be quickly involved in? The other thing that we were looking at is, to what degree, what is our state of health? And I'm going to be sharing a number of slides that were prepared by the Robert Wood Johnson Commission for a Healthier America, because Angela Glover Blackwell, who really regrets that she couldn't be with you today, she really was torn between the demands of what was emerging as a priority for the organization and her really commitment to want to be here. So she's a member of this commission, and so I wanted to share some of the slides that they're just recently releasing about their report, which you really should research and get a copy of that full report. It's really a very juicy, full of material in there. But basically saying the amount of money that we're spending on healthcare is not beginning to change the degree in which our kids and our Americans are still much sicker and living shorter lives than those in other countries. And that we all, and within this country, you look at nearly a fifth of all Americans live in communities that are not healthy. And those are communities with limited jobs, with very poor housing, that don't have access to healthy food, that don't have access for physical activities. Those are not health-promoting kind of activities. So we need to make some changes in those areas. Also looking at how our country is faring in terms of poverty. That currently, we did a report not too long ago which stated that 42% of children who were born in poverty tend to remain in poverty. Now, what do we need to do to change the poverty statistics so that, again, that population that's growing will be able to be competitive? So this gets to this piece around income inequality. And we've been hearing a lot about this. We heard President Obama mention it in his State of the Union address. It's been an issue that's been near and dear to our hearts for a period of time, of understanding that who are the people that's really making money in this country. We hear about the 99% and the 1% all the time, but when we research it, we realize that this stuff is really true. That, when we take a look at, the rise in top 1% of places, people are earning much more money. As you earn more money, the middle class is declining. And one thing that we know for sure, in order to have a thriving economy, we've got to build a middle class. We've got to figure out how to shift this statistic in our country, that we deserve to have a little bit more than what's represented now, because income inequality results in a lot of things that's really not good for the country. It contributes to concentrated poverty, where people can live. It contributes to a lot of inadequate education, where people can get educated. Basically, income inequality hinders growth. And what we're talking about now is the need for finding new ways of equitable growth patterns for this country to be viable. And where do we stand in this country in terms of life expectancy? In 1980, America was 15th among countries in terms of life expectancy. We dropped, we lost ground. By 2009, we were number 27. So, places like Iceland and Sweden and France and Norway and Canada, they all have much better life expectancy than we have in this country. So when people often ask me, what is this about your job, about Center for Health and Place? What is this about place? This is what we got to figure out, what is happening in places that's contributing to people being unhealthy and living in some of our communities. We've got to be willing to explore, what does this mean? And what does this mean in terms of looking at the trajectory of over the life course of a child? A child, again, we've talked about those who are born in poverty and stay in poverty. Those children whose families have more wealth tend to do much better. That family income is a predictor of a child's future. And we're not saying that every child who's born in poverty can't do well. Clearly, people can rise above, but we're talking about the majority of people who have limited access, not about their inabilities, it's about what do they have access to. And all of those things shape a child's sense of health and well-being. So clearly, bottom line, the more education, the longer your life. The more education, the healthier your life will be. The higher income, the better opportunities you have available. the higher income, you tend to have healthier children. So, I don't want to keep making this case. I think you're getting this, this one was interesting. I included this one because this was showing how women who are college educated tend to have added years of life than men who are college educated. So that was just quite interesting to see how, women who tend to have more education live 25 years older, so that you see that 80, you have a much higher percentage of viability the higher your education. That's basically what the whole gist of that slide is about. In that, when you look at income linked with racial groups, this is not surprising to see when we're looking at those who are above the poverty level, we're looking at people of color. And so it's African Americans and Latinos who tend to not be doing well. So I'm going to be moving past the doom and gloom really soon. This is the last slide. But I want to be able to show you what are the factors that contribute to these things. It's not about me painting a picture that's just a dismal picture. I am going to be talking about solutions in the next set, but I wanted to take a moment to say, what is it about communities when we talk about the sense of place? So we have coined the term called communities of opportunities at PolicyLink. These are communities that have thriving grocery stores, as opposed to low-income communities that tend to have fast food restaurants and mom-and-pop stores. These are places that tend to have really high-performing schools with AP courses. Other communities some communities don't even offer AP courses to kids, and so they get to college and they're really not as prepared as they could have been, not because they're not smart, because they didn't have the opportunity. These are places that have good transportation systems in these communities of opportunity. The other ones tend not to have bus stops that are frequent, or they close the bus stops after a certain period of time. The communities of opportunity tend to have thriving banks as opposed to check cash in places with predatory lending. So all of those things impact a person's health outcomes. Regardless of what their genetic makeup is, if you're in a community that's not health promoting, your chances of being healthy is going to just be much harder. So then what do we need to do? Solutions. Finally, yes, there are some things that are working. It is not a dismal picture. There are some exciting things that are underway across the country and right here in Colorado that we see as models that we need to begin to learn more about them, to dissect what are the ingredients of success, which I'm going to be talking about a little bit later, and how do we begin to replicate some of these models. So basically, building a healthy community means a few things, and these are just a few simple ones. How do we fully implement Affordable Care Act so people who were not eligible to receive care in the past can now get that care? How do we look at prevention as a way of doing the work and not just treating an illness after it's been already in place? How do we look at advancing equity in all of our policies? So there's a concept about health in all policies, and we take it a step further and say equity in all policies. And there are some ways that you can measure that. When you're creating a new program or a new policy, you can ask a few questions. Who's benefiting from this program? Who pays and who decides? Those three questions could help you to understand the equity component in that kind of a new policy. We need to improve access to healthy foods and environments. All of those are things that we know very well. So when we talk about this all-in nation, an all-in nation is one that is forward-looking about its demography. It takes be willing to take a look at it and to dissect it and to figure out what do we need to do differently. It's one that promotes growth-enhancing approaches. How do we make sure that we're building new businesses, that we're really trying to develop entrepreneurships, that we're creating jobs of the future? And we have to, bottom line, realize to have an all-in nation, we have to be all in this together. So this is too busy. I just wanted to include it because it's basically the RWJF Commission slides. And I believe that you all will probably get copies of these slides or have access to them so that you can get a little bit more information about what is being required. But basically what they're saying are three things in order to change your policy agenda. Invest in children, revitalize communities, and to be more health-focused in our efforts around doing this work. That in order to achieve these strategies, we have to look at some major ways in which how we're doing our work. That we've got to begin to take a look at who needs to be a part of the decision-making about new programs and new practices and new policies. It can't be the usual stakeholders. We've got to focus on community engagement. We've got to make sure that we're engaging people who live in communities, those who we're doing this work for, that they're a part of the solutions. That's a very easy concept to say, but it's a very difficult one to put in place. It's rare for somebody to say that they don't believe in community engagement, but they just don't quite know how to do it. And this is an area of work that we've been gaining a lot of expertise in a number of years. In fact, I was brought on to PolicyLink 14 years ago as a one-year policy fellow to study this piece around community engagement. And I was part of an author of a report by a researcher at UC Berkeley, Meredith Minkler, on understanding what is the value of community engagement. Does it really make a difference in programs and practices? And that research demonstrated that community engagement made a major difference in how programs are being developed and how they are run. And that there are some basic principles around community engagement that must be in place. We've got to be willing to look at how we build trusting relationships, how we are engaging people, basically how we're sharing power and leadership. Being willing to engage people, you have to slow the process down to involve community members. It takes longer. But you get longer-term results. And then I created this slide to basically show that when we talk about community engagement, everything isn't equal. So this thing about ascending impact and descending impact, and this is just my belief. My belief is that you get much better engagement and success when you have community engaged at a governance level. That's your top level. That your least level of engagement is town hall meetings where you bring people together once a year, you share your theories, you give them a nice meal, you provide child care, you tell them what you want to do, and then you send them home. That's really not real community engagement. We're talking about substantive engagement where people have voice, they can vote, they have a role to play. So we have to figure out how to really shift this in a different way. And that all of these things along the way, also, they all have value, but we're talking about the greatest value and the greatest impact. And so people have probably heard of health impact assessments. This is something that is in place. It's a set of policies where you make sure that before you do something to a community, you assess the impact of it. So before you put in a new housing development, to what degree will people who lived there before, will they be able to come back into the housing environment? When you put in a new development and it requires a lot of parking, how that congestion is going to impact the community? When you put in a new rail system, will you make sure that it's going to be addressing the needs of people? To what degree does dismantling of community infrastructure affect the health of the community residents? And they should have a voice in that process. So community impact assessments, here are just a few examples. That we've heard about light rails being in place and making sure that community members who live in those communities have a voice to play in it. How do we make sure that before the development occurs, you engage people? So again, when we look back in the historical perspective, we know we all remember, most of us remember urban renewal. Some people may be really young and don't remember that terminology. But urban renewal did a lot to improve communities across the country, but they also destroyed some small businesses. They also put highways in the middle of communities. So you have to take a look at how do you balance, the impact of these things. And I'm not saying it wasn't a good thing. I'm just saying that to what degree can we look at the impact in advance and not after the fact. And so this is a piece that we all know, that we've got to improve the food environment. And it isn't just about having grocery stores in every community. Every community isn't going to tolerate a grocery store. It might be how to convert the small stores. It could also be about how to really work with the mom and pop grocery stores, how to make sure that we're having all of these new efforts around urban agriculture and community gardenings, and we hear about farm to school, all of these things. There's different ways that we can improve the health of environments. I'm going to be talking about a couple of things that are in place in California. This is probably one of the most exciting ones, and this is a picture of the First Lady coming to the opening of a new grocery store in Los Angeles area, and it was really a wonderful opportunity because it's really showing public-private partnerships. Now, this was an effort where the California Endowment, which is the largest health funder in California, put $200 million to seed this effort. It is now $264 million through the cooperation of banks, through the Grocers Association, through Kaiser and other hospitals. And what's nice about it is that individuals can buy into it with $20. So this is a way in which you have local members being able to build wealth, which is really important in order to change this poverty thing. So it's a very lucrative and exciting way. And many of you, how many people are familiar with the Health Food Financing Initiative? Well, you know, there's a major effort underway that began in Philadelphia a number of years ago, and this was something that was very interesting. This came about as a result of the lack of grocery stores in Philadelphia. Grocery stores were closing all across the country. And so it began as an economic development, community development initiative, but it ended up having jobs because as they opened grocery stores, they hired people from the community. It became a workforce initiative. It was certainly community engagement, and it was also about having the bottom line of health being improved. That was taken to scale to the Obama administration. It began the Healthy Food Financing Initiative in Colorado. Is now one of the leaders in this initiative, and so we congratulate you in your Healthy Food Financing Initiative in Colorado. Now, this Market Creek Plaza in San Diego is also a really lovely story because the Jacobs Family Foundation took a long time to invest in this underdeveloped area of San Diego. And they basically went into the community and asked the community, well, what do you need in order to be healthy, to have a better community? They wanted a grocery store. Now, they chose Food for Less. That's what they wanted. And so that's what they helped them to build. And this is a way in which they are required to hire community residents who are in the stores. They also have a part of shaping the community development efforts, and they're just doing groundbreaking and bringing in a new Walgreens that I just heard about just in the last couple of weeks. So this is a place that is really community-driven. The Jacobs Family Foundation had a very interesting philosophy. Their philosophy was that we had heard about the adage of you give a man a fish and he eat for a day. You teach him to fish and he could fish for a lifetime. And they went a step further and said, well, if you fill the pond with fish, they'll always have food to eat. So they take it a step further of making sure that people have access to the fish. It's not about just trying to go and find out where they're going to be swimming. So it's a key of really building community capacity to be stronger and to be healthier. So again, I'm just citing a few other examples of really promising practices. Robert Wood Johnson Foundation has funded a really incredible partnership of bringing lawyers into community clinics to help their clients with problems, because we know that people coming into community clinics, it's not just health issues that they're faced. They're facing with housing issues. They have issues around, pollution in their environment, toxin in their environment. They don't quite know their legal rights and how to get this stuff addressed. So I thought it was a very creative idea of having lawyers be available for people who couldn't afford to hire a lawyer to assist them with their issues. And another whole series of examples about having renovations in communities that we have heard about. And the Minnesota Central Corridor is one that was also, they had agreed to have this light rail, but they had not included community, and they were going to have the rail just bypass a low-income community. The community basically said, no, we got to stop this process and change this around. And through that effort, they now have a rail stop that will be in that community. It was not a part of the design in the beginning. So this is just an example of how advocacy of having community engaged could really shape and reshape programs and policies. And we've been encouraged to hear, again, about the minimum wage being proposed to be higher as a result of President Obama making that suggestion. Some businesses are choosing on their own to do this without being mandated, and I thought that that's really very encouraging. Now, the study that we read about showed that by raising the federal minimum wage to $10.10, it would raise earnings for 16.5 million workers. Those are the kinds of recovery that we need to see in place. We were also pleased to hear that Walmart was no longer going to be oppositional about increasing the minimum wage. So these are things that are happening that we have to applaud, and we're very happy about. So I'm winding now, and I just want to leave with understanding about, as we do this great work, how do we assess impact? How do we make sure that we're getting the bang for our buck? How do we make sure that what we're doing is making a difference? And so as we started to look at what we consider ingredients of success, we've done a lot of research about things that are promising, that have made a difference. And I have identified a few key features that seem to come up a lot. And the first one is having strong leadership. Having someone at the helm who really is committed for the long haul, who's a visionary, who's bold, risk-taking, think outside the box, willing to do the work over the long period of time, commitment across sectors. It's not just one sector that's going to address this issue. It's not going to just be health. It's not going to just be education. It's got to be a broad involvement in order to really make the changes that we're talking about. It's got to be an equity-focused set of strategies. There's got to be creative, compelling use of data. How do we look at the data and see how do we make this data tell a story for us and our communities? How do we build more partnerships with government and community? And this is another one around adequate research. You cannot expect to have a major impact by having a 2-year commitment with $200,000. It's got to be long-term with adequate funding. And those who've stayed in there for, like the Jacobs Foundation has been with Market Creek for years. The California Endowment Initiatives that have made a difference have been a 10-year commitment. So being willing to stay over the long haul and be able to address all of the challenges that may come in it is really important. And there's got to be continuous review and assessment and make modifications as needed. We have a tool on our website that people should be welcome to go and view. It's called GEARS. It stands for Getting Equity Advocacy Results. And basically what it's doing is helping advocacy people who are doing work figure out how to do it and how to measure its impact. Everything about how you build your base, how to engage others in your strategy, how to talk about it, how to do your naming and framing of the issues. It's really a very dynamic and interactive tool that you can access on our website and learn how to assess equity impact. And this other slide that we have a VP for research that we've been working on trying to figure out what are the indicators for health equity. We've come up so far with these 3 things that we're continuing to research and to study. One is that we want to measure community conditions. What's happening in the community before and after an intervention? We want to take a look at to what degree have campaigns and strategies and policies made a difference. Can we attribute some difference as a result of these things? And then the last one is about measuring actual health behaviors. So we can't just look at the long-term impact of, we got to just look at infant mortality. It takes a long time for infant mortality rates it takes a long time for BMI rates to go down. But there are things that we can measure along the way, the interim goals that have to be captured and assessed. So, as I close, again, we have to make sure that we're creating an equity-focused agenda and one in which everyone can participate and prosper. And that we want to make sure that, again, this quote from the Robert Wood Johnson Commission basically is saying that in order for us to become healthier and to reduce the growth of public and private spending on medical care, we must create a seismic shift in how we approach health and the actions that we take. And as a country, we need to expand our focus to address how to stay healthy in the first place. And with that, I thank you so much. And again, I applaud you for the great work that you're doing in Colorado and look forward to having us continue to build a partnership to know that you're not doing this work alone, that you have partners such as Paul Fink. And feel free to call on us. We're here to be there with you. Thank you. I'm supposed to be over here.
Trying to turn my mic on and I'm causing trouble. So at this point, we'd like to open up for questions for Mildred. I'm going to start because I get to do that. So we understand that the investment and the activity needs adequate resources over a significant period of time. As we engage in this work and get started in working with communities, do you have advice on where the best places, the most important places to start are? looking across the list of interventions that you had, understanding that to be successful, we have to address all of them, are there some that we really need to prioritize first in moving forward?
So thank you for that question. Ooh, big echoes here. So I have come to identify 3 major areas that need to be addressed in order to really make change happen. That is addressing the education, because we see that education is a predictor of life trajectory. Changes that must happen in communities. How do we invest in communities to be healthy? And number 3, issues around race and culture. The degree to which we're comfortable talking about racial differences, that I think many times in this country, people think that when you're addressing the racial inequities, that you're accusing and pointing fingers and saying somebody is racist. You can talk about racism without accusing someone of being racist. So how do we have a dialogue in which we can talk openly about issues of race and culture, what needs to change? And then how do we really address the educational systems, and how do we change the community? Those are all 3 really big things. So you can say even within those things, how do you dissect it a bit further? Because of my work in the Center for Health Equity and Place, I would like to begin with changing the environments. How do we create healthier environments? And those are things that we can begin to do right away. How do we help people have healthier homes? And how do people keep their homes? People have been losing their homes as a result of the economic downturn. Now that we're beginning to build back up, how do we use opportunities that can build the community infrastructure? So those are big things. I don't know if you want me to go deeper into any of those a bit more.
Well, I don't want to be selfish, so I'm going to throw the questions open to the group. And start right here.
I have a question about how to plug in. Oh, sure. I have a question about how to plug in. I'm self-employed, care deeply about these issues, have expertise in community engagement and so forth. I have colleagues who also care about it. We can't do our work without some income, although we value volunteerism as well. So I know there are grants, I know there are opportunities. What do you suggest we do to find a way to plug in?
Well, thank you for being willing and interested in trying to figure out how to plug in. There is a number of ways in which you can serve as an advocate. How can you, if there is a particular community that you're interested in wanting to make a difference in, how do you find out from them what it is that they need and how you might be able to use your support, your resources to be an advocate for them? You might be able to help to link them to a political leader who could be a champion. You might be able to help to facilitate them meeting someone else that could make a difference. So every single person has a role to play. The key is figuring out what is it that your unique opportunities are, what are your unique, what your unique contributions are, and how to link them to those who need them the most. You may have skills around as research. How do you help translate research in a way that people can understand how to make it happen? It could be something as providing transportation to getting to meetings or getting to medical. There's a range of things that people could do in order to make a difference. That's all valuable.
Great, thank you.
Mm-hmm.
Question up here.
I have a question about an early slide you did relative to your data, and when you were doing some research, you mentioned that there seems to be an appetite for people wanting to have equity in America. Mm-hmm. So I'm wondering if there's a clear line of sight between that attitude around equity and residential integration, housing. Do you understand the question I'm asking?
No, I'm not quite sure.
So let me ask you like this. When we talk about communities and getting communities work and under-resourced communities, because mm-hmm. low-income communities tend to be under-resourced, mm-hmm. and we know that there's certain residential patterns, housing right. patterns that mm-hmm. exist within the United mm-hmm. States mm-hmm. That can be inclusive as well as exclusive. Mm-hmm. So is there clear line of sight, or was there a deeper investigation of people's mm-hmm. attitudes and how their attitudes show up in terms of housing patterns, where people live, as well as their receptivity to living in diverse communities?
I see.
Living, you know, mm-hmm. because That's one way for us to achieve some equity and bring resource into communities as well as some of the other things that you've mentioned. Does that make sense to you now?
I understand what you're saying. So that was not a question on the survey, to what degree are you willing to live in communities that are more racially diverse? I mean, that's sort of like what you're asking. But what I could say is that even though our countries, many of the poor communities tend to be racially segregated, you know, at this day and time, the efforts that are underway to make that change happen are happening gradually. And it happens in ways that we hear about when we're tearing down old development and we're building new development. Having a certain percentage of mixed income in housing. I mean, that's a policy that has happened in many places, that before you rebuild anything new in a community, a percentage is going to be a third for low income, a third for middle income, and I don't know what the other third is. People, I'm not quite sure where they may be students or something. But having those kind of policies in place will help to diversify your community, and it creates more interest. I know that in the community where I live in Oakland, California. There's an area of Oakland called West Oakland that has always historically been viewed as being low income and low wealth and kind of poverty. That area is changing in such a degree where I see, you know, I drive by now and I see white families with kids in their carriage. I mean, I visited one friend who, her building was renovated and she was the only African American in there. So, and I felt like people are really comfortable living in these areas. I mean, I was kind of surprised. So I think that there are pockets where these things are happening, where people are feeling that they're consciously wanting to live in communities of difference, that they are stronger, that they want their kids to be raised with a broader sense of diversity. And so they're making a conscious decision to do that. But we didn't ask that as a specific question, but I just think that I believe that that shift is occurring, but it's a slowly occurring trend.
Maggie, do you have a question from outside of the room?
Yep, this is from our online audience. As population of people of color grows, will people argue that disparities no longer exist? How should we combat that thinking?
No, that does not mean that disparities no longer exist. It means that, and basically the slides were showing that some disparities are so complex and so entrenched that they're very hard to erase. So there is not an association between the changing demographics and the disparities. It just means that, you know, as a whole, the country may be, in terms of like this obesity study that just recently showed, we have to make sure again that those trends are going to be impacting those communities that are most in need. So everything has to be reviewed with the lens of, yes, we're happy that these trends are improving, but we want to make sure that as we go deeper into the analysis of the data, that those who are most impacted are not being left out of the equation.
Hi, thank you for your question, for your comments. I have a question about measurement, and you put up there some conditions that you are starting to look at around measurement, and I'm wondering if you could speak a little bit more about the progress you've made in that area, and then also if there are any communities or programs that you highlighted that you feel have really done some innovative measurement and evaluation around the implementation of these programs and the community conditions, and then really linking that to any behavior change.
Yes. There's a tremendous amount of examples of things that are making a difference. In the San Francisco area, let me just stop and say that my team is in the middle of an intensive study now. We're researching these places across the country that are calling themselves Health Equity Institutes. Many of you might have heard of them. They're Centers for Health Equity Institutes. And so we were interested in seeing, what are these all the same? Are they doing the same work? They're using the same terminology, but are they doing the same thing? And they're really not. And so we've interviewed a number of people, and we're focusing on public health departments and those that are not helping public health departments. But within public health departments, we're seeing some tremendous things that are happening, and that's the place public health departments are responsible for measuring these things. And so some of the most progressive things are happening in public health departments. So the Seattle-King County Public Health Department has demonstrated how their health equity, and they're putting racial equity at the center of their work, and that they have put in place a number of strategies and programs that are measured by addressing health equity that's changing in how they're doing their work. In San Francisco, when they were looking at making changes, they were addressing health equity by improving the minimum wage years ago. So there's a whole index around community health factors that can be viewed. So I could talk to you offline about some of the places rather than naming them all right now, but Boston Public Health is doing some amazing, so there are some amazing things where people are making significant changes in which they can measure how those changes, but they're long-term measures. They're not going to be short-term measures.
Hi, yes, I have noticed that both on your Policy Link site and the Advancement Project, you do a lot of work around mapping and really mapping out community by community, neighborhoods, what are the different health issues, where are those neighborhood grocery stores, where are those parks, where are those quality early childhood centers and after-school programs? And if you could, I wonder if you could talk about that, because I think that's something that in Denver and I think across the state is something that we haven't made enough of a link between visually capturing our data and using it to tell a story. Because my experience with policymakers is that words alone simply don't work.
Yeah. Thank you for that. That's a very good question, and you're absolutely right. They don't want to hear. They don't want to hear any more stories. They want to be convinced. You've got it. That's why I was saying compelling use of data is really important. So let me tell you a little bit of a story. About 12 years ago, the California Endowment decided that they wanted to do something to address asthma in the state of California, but they didn't know where to. They didn't know what the investment should look like. They didn't know where to invest. And then so this is the work that we do at Policy Link. We're often behind the scenes doing this work that's considered thought leadership, where we're helping them to figure out what it should be. So we were doing mapping way back then. So we did GIS mapping to see where in the state are asthma rates the highest. So that was one profile. And then in those places, which places had the kind of infrastructure to support an investment, because you just can't put it someplace and they don't have a good program to manage the money. So where's there, and then where are the partners that you could work with? So we helped them to define where to invest based on what the mapping showed us. And then we went a step further, and then we were helping them to review the proposals. And then from that, we began to be a TA provider to help those sites create success in their policy change. But it all began with doing that GIS mapping. So the same thing with obesity. When we were doing the Robert Wood Johnson Obesity Center, we wanted to know where are the obesity rates highest. And in all of these things, they tend to be some of the same communities have the highest obesity, highest unemployment, highest everything. So that's why we believe if you focus on place and you improve the conditions, you could address a number of these diseases, and you don't have to just be disease-focused in your approach. If you change the environment to be healthier, you're going to get better health outcomes that will address diabetes, that will address obesity, that will address all of these things over time. But you can't just use one singular sector approach. Does that help you?
I would have to jump in and at least make you aware of a resource that we do have in Denver, the Denver Health Equity Atlas, which was put together by Mile High Connects working with RTD. And if you go on if you put in Mile High Connects into your browser, you can get to that. And it's exactly what you're talking about. It's mapping out the Metro Denver area and talking about where are the schools, where are the grocery stores, where's the what's the average income of the neighborhoods, what are the affordable housing opportunities, and they layer them map after map where you can actually start to look at these areas that tell the story about where the problems are. What we would like to see, and we've talked a little bit about the CHI, is how could we get that kind of metadata over the entire state, because there are unique opportunities and unique challenges for the metro area, but Colorado Trust is statewide, and we know that there are lots of health and health equity issues that are across the state. But I would make sure that it's a fascinating resource. It's funded through kind of some federal grant, some national grant activities, and it's available to you now on the internet.
Hi, first of all, I just tweeted the link to the Regional Equity Atlas, so thanks for mentioning that. That's wonderful. I'm Rebecca Arno. I'm from the Denver Foundation, and I have a question about talking and conversations about race in community and how that links to equity. And I wondered if you have any stories or examples of places where community engagement is advanced by having those conversations about race, and that then links to health.
That's a very good question. Gee, see, what is the first that comes to mind? I could talk about work that we've been engaged with nationally through, again, the obesity, just using the obesity crisis as an example. So there were some communities, and this is just being very blunt in how some of the issues are viewed and framed. So, for example, there was one community that we were in where they were focusing on African American, Latino rates being high. Are you dismissing poor whites whose rates are also high? And what we're saying is that we're not trying to dismiss the rates of white, the whites where the rates are high, but when we take a look at the whole, it's just that people of color tend to have worse outcomes. And so how do we make sure that we're including everyone? But we have to concentrate our focus on this population because nationally, those are the populations that tend to have the worst health outcomes. And then when we started to talk about how it showed up in terms of how much we spend on healthcare by not addressing that, by people not having healthcare, they got it. So what we realize is that if people don't get the moral high ground about why you should do it because it's the right thing to do, when you start addressing the fiscal bottom line, people start to get it, oh, that's right, we're spending that much money because people are using the ERs as their primary health care, as opposed to those who tend to have a little bit better health care. So that's just one example of having, you got to use whatever is going to reach people. And it's not about, not being authentic. You have to be authentic, but you have to be able to be compassionate and saying we care about everybody. But if you take a look statistically over the data that I've showed you, it's consistently there's a pattern of certain populations who tend to have worse outcomes. And so how do we change? Because if those worse health outcomes impact the overall country's health outcomes, because it's a weight there. No matter how well some people are doing, if you look at the country as a whole, you're not going to be rising up if you're going to have those who continue to be bringing it down. So it's like, oh, okay, the light will go off in some of those ways. Does that help?
I have another question from our online audience. You focused on race and ethnicity and also age as variables of inequity. What about gender, sexual orientation, immigration status, and other variables?
Yes, when we talk about diversity, and again, I had to limit, I was surrounded by my papers last night, wanted to talk about so much more, and I said, I only have like 30 minutes. I think it went a little bit over. So yes, absolutely, when we're talking about diversity, we've got to address broad sectors, and issues around immigration is a major issue. If we had time to talk about a full set of policy agenda that I would want to recommend, immigration reform is up there with it, because we got to take a look at how we're viewing those of us who are in this country already. The issues around disability, that's a whole issue. The disparities in that population are significant. The disparities among people who are different, whether it's gay, lesbian, transgender, whatever, how do they feel when they have to go and get health care? How do they feel when people are not receiving them in a welcoming way? So everybody who's left out has got to be a part of this equation. It's just that for this particular agenda, I was narrowing the focus to some degree, but everyone who's not thriving has got to be seen as having value to this conversation.
Question over here.
Julie Farrar with the Colorado Developmental Disabilities Council. It's serendipity. I wanted to bring up that I am actually a member of one of the largest minority groups in the country, and we are rapidly growing as the population is aging. And you see the same disparities in people of color when you add disability into the equation, like you just mentioned just mentioned. And one of the things that I think is really important is as we're visioning these sustainable and healthy communities, that we take into consideration the ability to age in place. And so affordable housing is only one piece of it. Affordable, adaptable, accessible, and visitable housing, we really, really need to take that into consideration so that people have the ability to stay in their communities, stay active in their communities. And I think that that's one of those systemic issues that still, I'll admit I was addicted to the Affordable Care Act. I thought it was wonderful, raises all boats. But I feel now that I'm very actively involved. I keep raising my hand and saying, but what about us? Because people with disabilities, nobody wants to join the club, and it's still looked at as a special vulnerable population. So instead of building infrastructure for everyone, and we're looking still at people with disabilities as a special population. So I'm wondering how we can just bring into the discussion around healthy communities exactly what you just touched on, that the ability to age in place is critical to having healthy communities.
Thank you so much for that. And I had not heard that term before, being able to age in place. I like that very much. Absolutely. So when we're taking a look at housing, transportation, all of those are factors that have to be in place. I mean, I had to go someplace recently and they didn't even have an elevator. And I had to walk up some long steps. I mean, it was uncomfortable for me, and I don't have a disability. But I'm always thinking about, well, how do people get around? And I'm thinking about the elderly, how do people adapt? And so we have to be a lot more responsive in this country about how we are viewing this work. And so I will commit to you that I will use this this aging in place, or to be more, have the visibility a bit more about disability in the presentation. Thank you.
Hello, I was wondering if you could talk more about the fresh food financing that you briefly highlighted, and talk about what is happening and why that's so critical.
Oh, absolutely. Gee, that's a big story. Yes, that is a very important story, because this was something that we talk a lot about taking to scale. The reason, one of the things that our tagline is lifting up what works at PolicyLink. And what that means is that our goal is there are gems that are happening across this whole country, but people don't know about them. So how do we lift them up and shed light on them? So there are two things that we did at PolicyLink that really was able to take to scale in a meaningful way. And the fresh food financing was one of them, not we single-handedly, but we had partners with the Food Trust and the Reinvestment Fund to take that idea about, look at what's happening. And it began first in Philadelphia. Then it went from Philadelphia to Pennsylvania. So it was a city, then a state. Then several of us took that idea to the Obama administration, and it now became the National Fresh Foods Financing Initiative, and it just recently got authorized in a new farm bill. So that was an evolution that didn't happen before. That is putting grocery stores in low-income communities. It is also assisting those mom-and-pop stores. It gives money for conversion of those stores. We at PolicyLink have created a website devoted expressly around the Healthy Food Financing Initiative. Again, if you go to www.policylink.org and you go to the Healthy Food portal, you could see that is an amazing tool that you could use. You can get everything you need to know about financing a grocery store, how to get grocery stores in your community, some promising practices where things are happening. So it's an amazing tool that I encourage anybody to utilize. If you want to know anything about fresh food financing, that tool is an amazing place to use. The other thing that we took to scale was people who may have heard of the Harlem Children's Zone and Jeffrey Kennedy's work. That is an amazing effort that's looking at an educational impact of how do you take kids from cradle to career. That began in Harlem, 100 blocks in Harlem. It's now the Promise Neighborhood Zones that's implemented throughout the country through the Obama administration. So there are things that are doing really good work that need to be brought up to scale and highlighted in a way that we can all benefit them and replicate them.
So, Katie, I would just add that you probably want to talk to the Colorado Health Foundation, because they've been the lead agency in funding the Colorado Fresh Food Financing Fund low-income loan program that allows neighborhoods, small grocery stores, other groups to apply for a loan if you're a mom and pop store or fast food place, to add like fresh fruits and vegetables in a neighborhood, or bring a full grocery store into a neighborhood that's a food desert. So they've been actually working on this and are implementing it now. Colorado Trust is a small investor from the standpoint of shared funding, but I think they can tell you a really compelling story. What was fascinating is that because of the work nationally and the big folks that are looking about bringing this to scale, they're actually consultants that can come into a state and tell them how to do this. And so that's exactly what the Health Foundation did. And I think it's a very exciting program.
We have another question from our online audience. How can we foster future orientation or hope for our growing Latino population to graduate high school and beyond? And how do we build representative leadership?
Okay, so how do we build leadership and success within the Latino population? And the second part of it was?
That was the second part. The first was how can we foster future orientation for the growing Latino population to graduate high school and beyond, so education and then leadership. Yeah, so I think the first thing is when I was saying to Ned earlier about the educational policies is a significant place that has to happen. So to what degree first are people aware of educational opportunities? The second thing is how well are they prepared? How are we looking at education reform in this country so that all schools have the same quality education to prepare, whether they are Latinos, Asians, Black, whatever? So there should be an equitable educational system, which is currently not in place. Some communities have stronger educational programs than others. And so how do we have a more equitable array of options available so that people, and then everybody isn't going to go to college. So how do we prepare training and certificate programs? You know, I remember the days of, getting the trades. Well, that's coming back again because, it's nothing like when I recently broke something in my house. I had to call a repair person. It's like, $85 for 20 minutes to come in. So they're high-paying jobs that don't have to be four-year college degrees. So how do we help people understand about training and certificate programs and just provide a range of efforts? There's a lot of efforts underway around really promoting the associate degree program, using community colleges. People who can afford to go to four-year colleges can go to a community college and get skills and build their leadership in that way. So there are a number of ways that need to be in place. But we also have to look at the businesses. How do we make sure that businesses will be more open to hiring people who are different from who they are? How do they see that diversity is a good bottom line for your company? That businesses thrive when they have a more diverse workforce. You have a broader point of view, you have a more entrepreneurial efforts, you have new ideas, things that you hadn't thought about. So how do we promote the value of diversity as a business bottom line? And those are the ways in which people like Ned can be really very useful because, people in leadership who could say, we benefit from having this. It can't just be those of us who, well, she's an advocate. She talks about this all the time. But how do we make sure that others who are not the advocates are saying how we benefit by having a diverse workforce? And it matters. It matters to how we do our work. We all are valued. We all are better as a result of it. We don't want to just be the same. Am I correct, Ned?
You are correct.
Yes.
Well, I'm never going to argue with you. I think it was a real powerful message at the health department when I was there that there was a real understanding and hiring policies that said our workforce needs to reflect the community that we serve, and that was always a leading issue for CDPHE, and I'm certain it's true in other departments. I wasn't in other departments, but I think you can see the activity, the improved quality of the services that are provided to a diverse population in more than just the business sector. So it's critical for the government sector, it's critical for business, and I would say it's critical for philanthropy.
Yes.
One more from the online audience. So what role do funders have in resourcing data collection and knowledge management to increase awareness of race, ethnicity, disparities?
Somehow I'm not here. Could you read your question again?
Sorry. What role do funders have in resourcing data collection and knowledge management to increase awareness of disparities?
Well, absolutely, and Ned just gave the entry into that. Funders have a tremendous role to play and have played in being able to use data in a very creative way. And I say that foundations, philanthropy have a big mandate that they could play. It isn't just about giving money. It's about they can use their power as conveners, that they can bring people together to the table to talk about, well, how have you been able to make the change happen in your community? People come when foundations tend to call. So how do they use that as an opportunity? How do they leverage their resources in such a way? How do they make sure that when they're writing their grant proposals, they can put language that mandate a certain percentage? You must have a certain percentage of involvement and participation. You have to measure it in such a way. So there are a number of ways that foundations can be viewed as partners beyond the traditional just giving money out.
Maybe a last question here. Oh, I'm sorry.
Hi, thanks so much for your comments today. I was just curious about urban versus rural. A lot of Colorado is very rural and small communities, and how just some of these key indicators and key areas that you mentioned and the research that's being done, is any of it being done in rural locations, and would you say that the indicators or the steps to take in building health equity are the same or similar in urban versus rural?
Excellent question. And thank you for letting me know that I didn't talk about the rural piece, and I often do mention that, because it can't be one size fits all. It can't be one cookie cutter approach to this. And we do take a look at what are the unique needs in rural communities, and how do we make sure that we're addressing that need. And I can just tell you a little brief story. In California, people tend to view California as being very progressive, but California has some of the most, some of the poorest communities, and one of the most embarrassingly poor community is a rural area in the Central Valley where the majority of the food that we eat in this country is grown. That community doesn't have safe water. They've got to pay money every month to have water because their water is not good. So we're doing work around building the infrastructure. We're passing policies to make change happen to address those particular things. So all of these strategies, when we talk about housing and food, have to be uniquely applied to rural areas. That it's not going to just be a grocery store in a rural area. It may be, how do we have farmers markets? How do we create a better partnership between the farmers markets and the schools? Because that's been one thing that has happened in one of our communities as well, that in these rural areas, they have brought their food and that the schools are using to feed children. So how do we create those linkages better? So I totally agree that we have to look at the unique features in communities that are rural.
I think as the trust gears up on community engagement and community-based participatory grant making, one of the ideas is that we can't sit here in Denver and design a strategy or solution that's going to work in rural Colorado. Right. So, okay, we got that message, we understand. And the issue is to really go to the community that knows itself, knows its problems, can identify the solutions that a community can own. So we're looking for those authentic partnerships as we move forward in grant making for exactly that reason. I would say the same is true, if I could, just for in terms of a large metro area like Denver, because the neighborhoods are diverse and different and have their own unique strategies, issues to face, and solutions. And so that's where that kind of authentic partnership with community comes from as we try to roll our work out going forward.
So I'm curious as to whether or not you've looked at, we've talked about poverty and the effects of poverty, but as families move out of poverty, say into the lower middle class, whether you've looked at the question of the intergenerational transfer of wealth and the policies that prevent people from transferring wealth. One of the things we've always been interested in is, for example, the Medicaid requirement that people sort of, the look-back provisions and those things that require people to give up their homes if they need long-term care at the end of life. That's one example. But if you can't secure your foothold in the lower middle class by passing on your home or your assets to your children, then you don't have intergenerational progress. And so I'm curious as to whether or not you've looked at that issue.
Well, there's a whole unit at PulseLink that I'm not a part of. That's an asset building team. They're doing this exact same thing. So they're again, if you go to our website, you could research asset building strategies. There's a tremendous array of strategies that they have in place, everything from stopping the predatory lending in these communities to looking at other ways of building wealth, because in our country, home ownership has been the pathway to wealth building, but we know a few years ago, people lost their homes, and so they lost that option. So that there are some new ways that things are happening, but I'm not the best person to try to identify them, but they are. I would encourage you to or at the end, I could give you the person who you could speak to in our office around asset building. But that is key to wealth building.
Hi, Sam Murillo from Family Voices Colorado. Just a quick question about, you're talking about framework and messaging and meaningful stakeholder engagement in communities. How does the community go about impacting institutional biases as it relates to a system towards a community in appropriate and tactful ways to work with the community? Because there is an institutional bias component to many of the things that we're talking about.
So that's a tough one, because there's got to be a sense that their institutions and their policies in those institutions impact the environments in which they're located. And that is why there's, we've heard of the hospitals having community benefits, that they have to give a certain amount of resources and supports. It's that same basic idea that whatever community that you're located in, it's up to you and your sense of being a good business person to support that community that you're living in. So to what degree that institution can be challenged to see the value in having community have a voice. And if they don't see that as a value, then I don't know what it's going to take. It's going to take people helping them to see it. We don't always want to advocate for it being some kind of harsh, getting people out of the community. But those things have happened where when institutions have not been responsive, communities take up against them and they don't tend to do well. And so they have to, not that they have to, it would be in their best interest to figure out a way to see community as partners with them. If they could see that there's value, that there's contribution, that it helps their bottom line to have the community view them as being a member of this community-centered work that they're doing.
So Mildred, we're about out of time. I have a few final comments, but I wanted to give you at least the opportunity for what you would like to leave us with today.
Well, very engaging, good questions. It kept me on my toes there. Well, I'm encouraged by the questions because they show deep reflections. And what I would like to suggest that is there wasn't enough time to go really in depth with some of the maps that I shared with you. That maybe there could be a way that groups could talk among themselves and really look at the maps and to see, in my area, this is what the trend appears to be. What does this mean for my community? Do we have the kind of programs and policies in place that's going to help this next generation? As the baby boomers are beginning to retire, remember, there's going to be young people to come along and take our jobs. Do we want to make sure that they are going to be doing a good job with that? How do we make sure that in our community, what you are invested in your community, how do you look at it differently? How do you really go in there and look at the data and to see what other data need to be looked at? And how do you make a change in your approach to your work in these arenas as a result of what the data is sharing with you? That would be my suggestion, is that we really take the time to have small groups having conversations about the data, about the racial issues, about the cultural issues, and what could everybody has contribution. What could be our individual contribution? Me as an individual, me as a co-worker where I'm working, me in my community where I live, me in my sorority, my fraternity, me in whatever role that I play. How can I be a bridge to making change happen? Thank you.
Thank you. I think people in the room know that Colorado Trust has a long-standing commitment to all Coloradans, but particularly to those families and individuals who are most vulnerable. We understand we have a great role to play in lending a helping hand to those who are most in need and strengthen their ability to make healthy choices. We also believe, as you've heard, engaging communities is a key piece to achieving health equity. It's our intent to authentically partner with communities so that we can increase opportunities for all Coloradans to make those healthy choices and lead productive lives. I want to point out that the slides for today's presentation are available on our website, coloradotrust.org. And then we need to do some processing, and we'll post a live recording of the event in the next couple of weeks. Visit our website to learn about the rest of the 2014 and upcoming events. The next event will be here again at the History Colorado Center on May 8th with Dr. Manuel Pastor from the University of Southern California. So you've heard about him. We've got a great introduction, and we'll get to see him coming up. Please take a couple of minutes to fill out the brief survey. It helps us think about how we can make these more effective. And then I always have to thank some folks. This is always a team effort. I just get to stand up, and I don't even have to write my own words. It's a fantastic job. What can I say? I want to thank specifically Patricia Martinez, Elisa Bourne, she's going to kill me, Elisa Bourne, Tara Spar, and the rest of the Colorado Trust staff for the execution of these events. I also want to thank the staff of the History Colorado Center. Then we couldn't do this without the hard work of our Health Equity Learning Series team, Chris Armijo, Courtney Ricci, and Maggie Frazier. Thanks to all of you, and thanks for joining us. I hope you have some learnings that you can take away in your own settings, and I look forward to seeing you in the future. Thanks very much. Yeah. Well, our staff usually has that identified, and that most